That's actually. Good morning to all. Assalamu alaikum and good morning to all the panelists, the director, National Institute of Unani Medicine, and our most respectable panelist of today's international webinar, Professor Syed Zirrahman sir, Dr. Nazrul Islam, Dr. Fazina Hamid, Dr. Mariam Khachani, I, Dr. Alimuddin Khamri, Organizing Secretary, I myself on behalf of the organizing committee of this 2 days international webinar, on behalf of the director and the whole institute, we welcome all of you to the day's second international webinar, all the panelists and the participants. As per the pre-notified schedule, between 11 o'clock to 11:30, we had a deliberation from one of the reputed speaker from United Arab Emirates, Dr. Muhammad Kamil Saab. Because of some official assignments, he is unable to attend, he is unable to deliberate the presentation. He conveyed his message. He regretted the incidents because it is a government and official matter, so he couldn't able to present. Let me take a privilege to present myself on behalf of Dr. Muhammad Kamil sir, though the presentation is of not him, it's of mine, to keep this session active. So the rest of the sessions to be continued. I am Muhammad Alimuddin Khamri, the organizing secretary and head of the Department of Moalajat, National Institute of Unani Medicine, taking a privilege to start the first session with the permission of the director and all the panelists. Professor Zirrahman sir, Dr. Nazrul Islam, Dr. Fazina, Dr. Mariam Khachani. Is it audible? Is it audible?
Yes, Dr. Alim sir, you are audible.
Thank you, sir. Thank you. So the topic of deliberation, which I intended to place before the panelists and the august audience of the day second international webinar, immunity and the COVID-19. There are certain issues which we have recognized, understood with reference to the presentation of yesterday's very honorable speaker, the virologist from National Institute of Mental Health and Neurosciences. And he emphasized about the role of immunity that is being propagated by the alternative system of medicine, particularly in India, the Ayush system of medicine emphasizing only about the immunity in management of or relatively management as a prophylaxis and therapeutics in COVID-19. So let me have my presentation. During this presentation, we are going to understand something about the immunity, the historical evaluation of the immunity, importance of immunity in pathogenesis of the COVID-19, and the immunomodulatory drugs are certain regimens of Unani system of medicine whose importance, likely the effect in COVID-19, finally with conclusion. As we know that human body has a biological defense mechanism through which it fights against the infection and diseases. This biological mechanism is nothing but immunity. Basically, this immunity is derived from the Latin phrase, which is derived from the term immunitas, which stands for the exemption from paying taxes. It is a phrase in the Latin language, which stands for the exemption from paying taxes, that has been literally used as infection leads to a subsequent exemption from further reinfection. This is the gist of the understanding of the immunity with reference to the phrase of the French language. In fact, immunity is something, it is the ability of the individual's body to resist or fight against the infection and disease. That infection could be of a microorganism, chemicals, allergen, whatever it could be. Ultimately, it is the innate capacity of the individual through which can fight against all those things. Let me try to bring some of the historical evaluation of the term immunity, how this term immunity is there, since how long we are able to understand this term immunity. From the medical history, what we came to know for the first time, in fact, the earliest non-mention of term immunity was during the plague of Athens in 430 BC, reported by one of the Greek medical historian, Thucydides. According to him, he said that if a person infected with any infectious disease is free to be active against such a disease. All such a people got infected can be served as a nurses or the doctors to the other suffering people. Ultimately, he says that the people who are affected, they develop natural active immunity. In fact, the understanding of the term immunity, which dates back to 1798, when Edward Jenner, who is supposed to be the father of the modern immunization, he reported that people could be protected from smallpox with the variolation, nothing but it is a sort of immunization technique that he was adopted during his period. Louis Pasteur speculated that immunization protects against the disease. It means that the immune system learns to fight it. There are some authorities like Paul Ehrlich and Elie Metchnikoff during the mid of the 19th century. Both the scientists from the different nations and their students, they are discussing about that. There are several factors associated with the immunity. According to Paul Ehrlich and the students, they said there are certain antibodies which play a very important role against the organism or the infection. They call it as the humoral immunity. In contrast to this, Elie Metchnikoff and their scholars, they speak about beyond this humoral immunity, there are something which are cellular in nature. They term it as a cellular immunity, where they speak about the WBC and all those things. I would like to emphasize about that. The Greek sciences, all the pre-Renaissance period, all the medical sciences are thinking about, there are so many, as and today, they are supposed to be the irrational causes for the cause of the disease. Mean they have their own hypothesis about the bodily fluid dysregulation, temperamental abnormalities, some of the curse or the devil forces are the reason for the diseases. But when the Louis Pasteur and Robert Koch, like the authorities, they came to know about there are certain microorganisms which are responsible for the cause of the disease. Finally, they have given the theory of the conformation of the germ theory, which stands for no disease is away from organisms, or most of the diseases are as a manifestation of one another form of the infection of certain bacteria. And lateral, we have explored about different organisms where it could be viruses, etc., etc. Let me talk about this COVID-19 as this, because this is one of the pandemic, the biggest problem today globally the people are facing. Here, COVID-19 is organism, there's a virus, SARS-CoV-2, it's a virus, it's a given name to, it belongs to the coronavirus, as all of you know. WHO has declared as COVID-19 as a pandemic because most of the nations and the states throughout the world, as I came to know, more than 190 plus, around 200 countries, nations and states are affected with this pandemic disease. If you look at the global data, more than 3.5 million, 3.5 million means around 36 million people infected, out of which more than 1 million people lost their lives exclusively due to this pandemic. Of course, the recovery rate is very encouraging. 85% of the people are recovered from the infection. Only the 15% of the population are suffering with a mild to moderate, and even though they are also out of the danger. The problem concerned is only the 1% who are suffering with these critically ill cases. 1% of the population is critically ill. As a whole, the fatality rate is around 2.58% globally. Country like India is evidence reported around 1.58, around 1.6% of the fatality rate. As a whole, the disease is definitely have certain investigation through which one can be able to find out the diagnosis, like a rapid antigen test, this RT-PCR, CT, D-dimer, CPR, LDH, ferritin, etc. These are all some of the investigations which help us to understand the causative organism and the intensity of the changes in the body of the infected person. The conventional system of medicine globally, there is no standard protocol of a treatment to be followed to control the disease. But as a whole, different nations are following different antiviral drugs, some of the antiprotozoals, micronutrients, steroids. If the oxygen level saturation is came down, all such patients are kept on ventilators. And most probably we are expecting to control the disease as a prophylaxis to protect the large population of the globe. The vaccine is going to play a very important role. Now it is in the phase of development. This is the present situation and the scenario with reference to the conventional or the primary line of choice of the treatment to the global population. Let us try to understand this. This is something like a question, whether Ayush and COVID-19, whether stand for where we are standing. Where exactly the Ayush stand with reference to the COVID-19. This is the question, and we have the solution for this question also. Throughout this Indian subcontinent and the Ayush system, all the alternative system of people are just propagating and promoting immune boosters, because though we have a tremendous blowing history with the well management of all such infectious diseases throughout the past, when the matter comes to the coronavirus, COVID-19, the drugs what we have used in the past may not be going to prove efficacious. Ultimately, we are just staying with as a resort, final resort of management is immune booster. Why the Ayush people are focusing on the immunity and some of the drugs and regimens as an immune booster? I have something to explain and to share all of you the importance of immunity in pathogenesis of COVID-19. Here, the role of immunity somewhere which is acting against the pathogenesis of COVID-19 that will help you, that will help among the cases to prevent or to revert back the conditions manifested among the COVID-19 cases. I'm very happy to place before you. Yesterday, we had a very wonderful speaker, Professor V. Ravi sir, who is an authority head of the Department of the Neurovirology from National Institute of Mental Health and Neurosciences. And he is the chairman and the member for the task force committee for this COVID-19 government of Karnataka. Is a very reputed personality in the field of virology. He was giving us some reference with a review article published somewhere in the early of this 2020 about the pathogenesis of the COVID-19 in Nature Medicine. He said that even this paper also explains about that when the COVID SARS virus enter into the human body, its survival is exclusively depends upon the receptor, as because these viruses are going to be capture the ACE2 in receptors in the body. As we know, there are different parts of the body where the ACE2 receptors are, starting from the upper part of the respiratory tract and the lungs and different parts of the gastrointestinal tract and other gonadal parts also. So the virus, once it enters into the ACE inhibitor, ACE receptors, there it causes dysregulation. As a result, it changes the hormonal imbalance. And finally, it causes a direct cytotoxic effect there. And the second important mechanism through which, after entering into this human body, it starts replicating, and ultimately it causes dysregulation of the renin, angiotensin, aldosterone system. It is a hormone which plays very important role in regulating the blood pressure and several other important bodily functions. This is supposed to be the second function. Now, this is second activity induced by the pathogen. The third most important phenomenon which is trying to understand, probably this is the third one, is this pathological changes are also occur in the inside of the blood vessels, like endothelial cell, where the organism will causes damage to this endothelial cell. As a result, a nidus will form, and this nidus will attract the platelets agglutination. As a result, this platelet agglutination can lead to thromboinflammatory changes. This is one of the important point what we have observed among the most of the cases of viral pneumonia. That thing. Finally, the fourth, supposed to be the biggest mechanism which is lying here in the pathogenesis, is dysregulated immune response. As a whole, probably, maybe this is the most important point to be understand here. And I'm paying much focus about this point with reference to Ravi sir also, and to the best of our understanding. Once this organism crosses from different phases to 1, 2, 3, finally it causes dysregulating the immune responses of the individual. As a result, the manifestations of the system, manifestations of the clinical presentation among the individual will appear. Either it is in the form of a mild, moderate, or severe. I can say it is only the immune response of the individual, the host, who decides the nature of the disease, not by the virus. These are the words which what we have learned from the authorities. Further, I'm bringing to the notice of the august audience and the panelists, as Sir also yesterday quoted, Ravi Sir, and Louis Pasteur, the father of microorganism and the immunology, he said that here viruses are something nothing. It is only the host which is responsible for the manifestation of the disease. He referred one quotation: seed is nothing, soil is everything. Here the seed is virus, soil is the human body, a complex immune response of the body. So according to the virologists, don't blame the virus, try to understand the bodily immune response of the individual, how it reacts with the organism which enter into the body. So this is the way we are trying to understand the pathogenesis and the importance of the immune response. Let me take you to this, a formal understanding of the immunity. We know that immunity is the ability of when individuals fight against the infection and the diseases. We have classified, understood the different types of immunities are there. One is innate or the inborn immunity. Second, another one is the acquired, that is acquired immunity. Where this acquired immunity is further, we have a humoral, as already we have told you, the humoral, where this antibody mediated immunity is there. The another important is the cell mediated immunity, where the WBCs are going to play a very important role. Mostly cell mediated immunity, where the active immunity will be there. Suppose if a person infected and recovered from the disease, all such a people have developed active immunity. Other than that, some of the people have got the passive immunity through also. In Unani literature, we have a reference of a newborn baby. When they have started taking the feeding from the mother, the colostrum will provide a number of antibodies to them. So it protects like a passive immunity to them. So the concept of active passive immunities are there, that how they are going to regulate the human immune system. All these immunity related issues are regulated by a complex immune system, which is in the body. Different organs are going to take an important role in regulation of the immune systems. In Unani system of medicine, we have a different term for the immunity. Immunity, as it is, this is a Latin term, as a phrase that is being used throughout the world by the conventional people. And in Unani, we have a term called as a tabiat, which were also considered as a quwwat mudabbir badan, which tadbir mudabbir the badan. And in a classical Greek medicine, there are terms which they used: medicatrix naturae, that is nothing but the physis. Physis is nothing but the nature. In fact, this nature is the supreme power of healing all those things. Accordingly, physis has been dealt as this is the healing power of the body. So in toto, tabiyat, quwwat mudabbir badan, the classical term physis, medicatrix naturae, all are some sort of a understanding towards immunity. Let me come to this important portion of my presentation. The government of India issued a guidelines for Unani practitioners, particularly for COVID-19 management. As per these guidelines, they have given specific recommendation as a prophylactic treatment, where the zanjabil, gilu, asalusus, khamir marwarid, safuf asgan, they are the best medicines which possess antiviral, antioxidant, anti-inflammatory properties and immunomodulatory effect. So these drugs can be used as a prophylaxis. Accordingly, if the people they have suffered with any symptom, if the respiratory symptoms are there are specific set of drugs are there for respiratory problem, fever and other conditions. There are specific drugs are there. I don't want to go in detail because our subsequent panelists and the speakers, they are going to enlighten upon this. We have Dr. Fazina, she is going to talk about the important and the clinical study of the Bedana, Unnab and Sapistan. And similarly, Dr. Mariam and Dr. Nazrul Sam also going to share their experiences. Moreover, Professor Syed Ziaur Rahman is going to talk about the antidote Theriacs of Unani system of medicine, their outcome among the viral conditions. As per the directions of the Ministry of Ayush Government of India, there are certain drugs which are being propagated as a whole to the large population of the community to use as a prophylaxis like Baidana, Unnap, Sipistan. If people have the fever, Karanjwa is also been recommended as an antipyretic. There are certain antiviral drugs from the list of Unani system of medicine, which is being published by the government of India here. Kalonji, Sir, Zanjabil, Aslusus, Afsantin, Tukmakasus, Khiyar Shambar, Gilu, etc. These are all the established antimicrobial, antiviral, immunomodulatory drugs. Apart from that, I would like to bring an important information I would like to share with the august audience of this webinar. There is a concept of oxygen radical absorbance capacities also. Nothing but this ORAC, it is the quantitative measure to understand the total antioxidant capacity of some of the substances, particularly the traditional foods what we are using in the form of spices. I hope that all of you are well aware the clove, the karanfal, darchini, chobzar, kamuni, rihan, zanjabil. These are all the very common items which are available in our kitchen and day-to-day practice. We are well using this. We know that our parents, our grandparents, often they recommend they use this whenever we face any respiratory infection because they contain high ORACs. These high ORACs are very helpful in controlling respiratory related issues. Here I would like to focus on another important point is during the treatment of this COVID-19, often we have promoted to use some inhalations, laklakas, or aromatic substances where RKGB is being propagated. RKGB is nothing but it is a combination of satyapudina, satyajwan, and kafur. It is a liquid form that one can be used as an inhalator. Not only this, there are so many other drugs which can be used as inhalators once you can able to chew it, like this karanfal, darchini, zanjabil. They do have a good amount of ORC that will help in as an internal immune booster, as well as oxygen capacity also increases. According to the directives of the government of India and moreover the globally, there are certain general measures recommended to control, to prevent the further infection of this COVID-19. Here I would like to bring some important information. Basically, when the people came to know about this infection of the coronavirus, most of the people started feeling some sort of a very deprived kind of a moods. I can say a varied range of depression is being observed. Or a level of stress is increases among the people. For them, we can suggest them to use some of the drugs like Saat Kofi, Oud Sileb, Jadwar. They are all the very effective anti-stress drugs that will help them to come out of the stress related issues. And it is recommended that the people to have a pure, clean air free from germs. So better they start doing the fumigation with kafur, sandal, and whatever the sources are available according to their indigenous availability. Let me go to very near to conclude my talk. There are certain immunomodulatory regimens and drugs which often we use in Unani medicine are the regimen which stand for the Tadabir, where we can think of diet, exercise, and the behavior modification. If you look at the diet part, the diet encompasses the nutrients. There are a set of micro and macronutrients are there, where we'll talk more about the role of micronutrients in the subsequent slides. In Unani, a greater emphasis has been paid to regular physical movement that we call it as a riyazat or exercise, because exercise will improve circulation and eliminates waste on the body and relaxes the body. Not only that, it provides antioxidant relaxation and rejuvenation effect. There are several studies which suggest that regular moderate exercise will boost your immunity that can prevent infections also. Most important thing is maintaining the circadian rhythm. Appropriate amount of sleep is also very essential. Otherwise, if the people are not following the sleep and wakefulness cycle according to their age and their lives, what's called as occupation, it can lead to there is a deprivation of the immune related issues. So one has to maintain a balance of the sleep according to their ages. And there are so many important outcomes have been observed with the bathing, hammam, because hammam has played a very important role as antioxidant relaxant effects. And moreover, it eliminates the toxins from your body. And the most important, one of the regimen is the Tazhab Shams, because this is the natural way of obtaining vitamin D3, because there are so many studies which is suggested that vitamin D deficiency can lead to a number of viral infections, particularly the influenza, and now more emphasis has been paid. The people who are taking additional vitamin D3 are protected from coronavirus infection. So I recommend my people or all the people to keep expose yourself between 11 o'clock to 2 to the direct sunshine. As I told you, there are certain micronutrients, vitamin B6, C, D, E, minerals like zinc, iron, chromium, selenium. These are all playing very important role in regulating all these things, the immunity particularly. If you think about what is the source of all these things, micronutrients, there are a number of vegetables, fruits, spices, meat, poultry, dairy products, seafoods, nuts, and fortified foods are there. Because all these micronutrients, they carry antiviral, antibacterial, antioxidant properties, anti-inflammatory, and some of them are enhances the cytokine production. It acts on T and B lymphocytes, nitrogen oxide, etc. So this is about the dietetics, which is we thought to be shared with you. Let me come to the immunomodulatory herbs, what we have in our literature and we often prescribe to the people are this Elva, Mulatti, Seer, Zanjabil, Chobzar, Amala, Tulsi, Asgan, Brahmi, Halila, Gilu, Satavari, Darchini, Buyamla, Zafran, Filflesia, Karanfal. Of course, these are all the very available common drugs. Nowadays, the people are promoting even most of the products are available in the form of immune boosters. Like one another, you will get this Mulatti and the Zanjabil. That is nothing but the Sont, the Sonti. Chobs, the golden milk is being promoted. Amla, Tulsi. There are now using as something like all these are the products are using very abundantly, and the people are getting good response also by regulating their immune system. Pictorially, I thought to show you, this is the first one is aloe vera, this is Elva, Mulatti, this is Seer, Zanjabil, Chobzar, Amla, Rihan, this is Asgandh, Brahmi, Karanfal, Filflesia, Halila, Buyamla, Mulatti, and this Zafran, etc. These are all the drugs which are known to us, and all these drugs carry immunomodulator effect. There are certain compound medicine which are available in Unani medicine. They're very popular one, and even the government is also propagating, and all the practitioners are recommending to use this, like Khamira Marwarid, Khamira Presham, Khamira Gauzaban. There are Theriacs. I don't want to talk anything about that because the next speaker is going to enlighten upon the importance and the roles of all this Theriacs. The most one is throughout the literature, a great emphasis has been paid to use Theriac vabai as a preventive drug. Theriacs are nothing but the antidotes during the periods of epidemics. And like that, we have a second Japan limuni, Sirka limuni, Murabba amala, Jawarshe Shahi, Jawarshe Jalnus, Dawal Kurkum, Asanasia, Majuna Sirulmul. There are different other compound formulations that can be used as a prophylaxis or as an adjuvant with the other medication. Coming to the conclusion of my discussion, as we know that infectious diseases are known to human beings since antiquity. Mankind learned things from nature because nature is the best friend for all this. Because nature, but most of the time it is observed that without medicine also, the bodily immunity or the nature itself help the sufferers in the form of either the purgation, emesis, diaphoresis, diuresis. Ultimately, they regain the normal health. Immunomodulatory drugs and regimens of Unani system of medicine are scientifically proven. Their effectiveness have found to be strengthening the innate powers of the individual. Otherwise, we can say that they are the immunomodulators. Hence, such a drugs or regimens can be used either single as an immunomodulator or as an adjuvant with the conventional drugs to restore the health, to fight against this pandemic, not only the pandemic, any sort of infectious disease to keep healthy. Thank you. Let me take a privilege to invite I'm very delighted to invite our speaker, the invited speaker, the guest speaker of the day second program is Professor Syed Ziaur Rahman sir. Academically, he's a having an academic record. Is MBBS, MD, PhD, FIMSA, MAMS, CMCL, FKIMER fellowship holder. Presently, sir is working as a professor, Department of Pharmacology in Jawaharlal Nehru Medical College and Hospital, Aligarh Muslim University, Aligarh. As of today, sir is having more than 2 decades of experience, a large experience as a basic and clinical pharmacologist. And in his account, so far he has published 7 books, 17 contributed 17 chapters, and more than 200 research papers published in the national and international journals. He edited 11 periodicals and has been invited to deliver more than hundreds of sessions as a guest speaker in national and international conferences and different sort of programs. Into SARS account, there are 70 international conferences and 85 national conferences are there. Sir has got international postgraduate research scholarship to pursue PhD from University of Western Sydney, Australia between 2010 to 2012. He involved with members of 40 learned educational bodies like International Medical Science Academy, National Academy of Medical Sciences, International Society for Pharmacovigilance, Indian Science Congress Association, Indian Medical Association, Safety Pharmacology Society, Australian Society of Clinical and Experimental Pharmacologists and Toxicologists. INCLIN, there's a regional network of INCLIN, Association of Physiologists and Pharmacologists of India, Indian Pharmacological Society and Academy of Indian Origin, Australia. He served as an academician, a researcher. More than 24 of research work has been carried out at the post-graduation and the PhD level. Sir has contributed to all alternative and animal testings. His contribution is no way deniable. Sir's contribution with the field of association with the field of Unani system of medicine is remarkable. Recently, we are happy to have a book released on Advai Kalbiya of Ibn Sina. I request all our participants and the panelists to please refer this book. Recently, the book has been published. It is one of an authoritative book on the Advai Kalbiya with a modern understanding that Sir has brought down. Sir's work in Unani, particularly the de-addiction techniques, where Sir has used Jadwar Delphinium Didentum. Sir is associated with the India's National Pharmacovigilance Program also. He is one of the active member and pioneer of this Society of Pharmacovigilance of India also. With this brief, I request Professor Syed Ziaur Rahman sir to start your lecture. It is over to Professor Ziaur Rahman sir. Thank you.
Thank you, Dr. Alimuddin Qabri Sahab, for such an introduction, but I don't deserve for all these details. But anyway, it's so nice of you that you have mentioned about my work and everything. So I start my presentation. Before this, I would like to congratulate the whole organizing committee, because you people have organized another session on last month only, and so consecutively you are organizing another session on a very important topic like integrated approach to treat in the treatment of COVID-19. So I start my presentation with my greetings to Dr. Abdul Wadood sir, Director NIUM, distinguished panelists and participants. So the topic which was given to me is pharmacology of Unani Theriacs in COVID-19. So Theriac is something which is not used in allopathy system of medicine. It is very unique concept in Unani system of medicine. So I'm not going again into the details, as you all are aware how coronavirus was started, and but important thing is still the symptoms are not very clear. It has some asymptomatic diseases to life-threatening complications, including acute respiratory distress syndrome and multi-system organ failure. Ultimately, death are also reported. And we know that older population, including the patients who are having comorbid diseases, they are more prone to COVID-19. So in the absence of proven effective therapy, the current management basically is consisted of only the supportive care, where we give invasive and non-invasive oxygen support, you all know, and off-label, or there are WHO programs like compassionate use therapies, including the antiretrovirals, which are again not specific to the COVID-19. sometimes ivermectins, anti-inflammatory drugs, and convalescent plasma therapy is also reported, including traditional medicine. So we are here to discuss about the possibilities of traditional medicine in COVID-19. So again, I'm not going into the details of the concept of Unani medicine. You all are aware, but important thing is, if we follow the basic concept and the philosophies of Unani medicine, we would be better able to treat diseases like COVID-19. So there is a need to look into the basic philosophies, because if you follow these, we may protect patients and take some precautionary measures. So there is no need to, Dr. Alimuddin Khamri also has mentioned all these philosophies, so there is no need. But I would like to say that again, because we are here to discuss this COVID-19 epidemic, and again in Unani system of medicine, again you all are aware that this is one of the disease which has environmental cause. So in Unani medicine, you all know that there are some causes. So this is a part of Amrazia Vaba. You all know that what is this Amrazia Vaba, and again, we need to look this COVID-19 in the light of the Unani concept, especially the humoral theory. And there are some terminologies which are very commonly used in Unani system of medicine, like Nazla Wabai, Homai Waba, Zaturia. And we also know that etiology is also mentioned in Unani system of medicine, like Ajsame Khabisa and Ajsame Ghariba. So Gariba is the foreign substances. You all know that microbes and viruses must be the causative factors. So we need to look the indicators about these Mrazivaba, and we need to take the preventive measures. So we have already discussed a lot about the preventive measures, what drugs needs to be given and what drugs needs to be taken for the prevention. And again, in Unani system of medicine, there is a very well concept of quarantine system and the use of other substances. So my topic is basically to look into the possibilities of Unani Theriacs in the COVID-19. So if we see, these Theriac is basically meant for Wabai Amras. And if we see the etymology of the word Theriac, which is derived from Greek word Theria, which refers to wild beast. Wild beast must be like snake, venom, scorpions. So the Theriacs were supposed to be given in these wild beasts, and preparations were made, and that's why this is a term which is which indicates antidote or anti-poisons. But nowadays, most of the Unani physicians, they use this terminology for other purposes and for very minor ailments also, like tiryake meda and tiryake pechish, tiryake azam. These are not like if we see the original terminology, and so but it's still this is also used. So this is synonyms to many other conditions and many other diseases. So if we see the origin of Theriacs, it is the earliest formulations, and even you can find in Kos Island, there are stones in the temples of Asclepius, or the temple of Asclepius. Although Asclepius was not so scientific, but still the scientist which later on developed this theories, they inscribed the formulations on the stones of temples. And for example, still in the Kos Island, there are some stones which includes Theriacs, which like thyme, straight myrrh, aniseed, fennel, parsley. Although these vegetables are not commonly found in Indian subcontinent, but they are very well known in European countries, and they still use these vegetables in food. So if the earliest Theriac, which you all know must be like Theriac Muslitus, which is the basically the Mithridatum. Mithridatum word derived from the king Mithridates VI, because he was the king who always had a fear of attacking by some enemy So he was the king of Pontus. His physician prepared Mithridatum, Theriacs muslidutus, which led him to protect from the poisons and including the uh, scorpions, vipers, sea slugs, and other toxins. And other Greek Theriacs, which you all know, in fact, Alimuddin Khamri Sahib also mentioned Theriac Farouk, which is the Afai means the snake. So that is specifically meant for the snake bites. It had 48 ingredients. And then Theriac Andromachus, which had 64 ingredients, and that has including the flesh of viper and opium. And in the picture, you can see that in India, we used to have martaban. And similarly, they had very beautiful containers for these Theriac. And you can see there was a mention of Mithridatum and Theriac Andromachus. And the picture of Mithridatus king who was supposed to take this Theriacs, started taking Theriacs. Then, after Greek, Romans came into the power, and Galen was the most influential physician who also prepared Theriac and wrote books like De Antidotes 1, De Antidotes 2, and De Theriaca et Pois Pisonem. Again, he prepared and included many other ingredients, including the honey, wine, cinnamon, and that's why his Theriac later on came to be known as Tranquility Theriac or the Galani Theriac. So again, you can see the beautiful containers where these preparations were used to contain. So after Greek, Romans, and then Arabs developed Theriacs or modified Theriacs. If you compare the Theriacs of Greek and Romans, Arabs used Theriacs with lesser ingredients. Like for example, Theriac Samania. If you compare with the Greeks, Theriac, they had 64, 48 ingredients, but Samania, you all know, it means 8. So Samania, so it has 8 ingredients only. So you can see Murmaki, Habulhar, Juntiana Rumi, Pust Talq, Felfelsia, Taj, Zafran, Darchini was the main ingredient, or the main, they are the ingredients of Tidyaka Samania. Then Tidyaka Vapai, although it's again the Greek Theriac, but Arab physicians modified it and reduced to only 3 ingredients. So here I would like to mention that if you see the differences, Arab physicians not only reduced the ingredients but also included only the important one. So Teriyak Vabai, although low, late, but it's still commonly present in the Unani system of medicine. Teriyak Arba has 4 ingredients, and Arba means 4. So Habulghar, Duntiana Rumi, Murmaki, and Zarawan Tawil are the 4 ingredients. So, as I was mentioning that I was asked to look the pharmacology of these Theriac or Theriacs. So it's next to impossible to cover in this short presentation all the drugs, but I would like to mention these 2 Theriac, like 4 plus 3, 7 medicines. So before we discuss these 7 medicines, if you see this diagram, you can clearly see that in the COVID patients, this is the main pathology: hyperventilation, hyperinflammation, where there is cytokine storm and reactive species generation and membrane integrity, immunosuppressive. So plants or the herbals which are needed should have anti-inflammatory properties, should have antioxidants and cytoprotective, immunomodulatory activities, and also antipyretic and anti-inflammatory. Dr. Alimuddin Khamri has already discussed about immunomodulation or the immunity system of these drugs. So again, as I said in this short presentation, we can't discuss the pharmacology of these 7 drugs, especially in relation to anti-inflammatory, antipyretic, or cytoprotective. So we will discuss only antiviral, antioxidant, and immunomodulation. Again, if we see the scope of herbal antioxidants, even in allopathy system of medicine, antioxidants antioxidants are not tried in COVID-19, but we have a past experience that antioxidant therapy is known in sepsis and acute respiratory distress syndrome and acute lung injury. And in these conditions, antioxidants has a good effect. It's like it improves oxygenation rates, glutathione levels, it strengthens immune response, reduces the mechanical ventilation time, length of stay in the intensive care unit, multiple organ dysfunctions, and the length of stay in the hospital. So antioxidants has a very good results in these respiratory diseases. So we can expect that herbal antioxidants could also play a role in COVID-19. So this is a paper which is discussing antioxidant therapy, a useful complementary measure for COVID-19. This is, I'm not going into details as Dr. Alimuddin Kamri has already discussed this in details, the immunomodulation, but herbal antiviral, this could be seen because we will see these Theriacs ingredients has any efficacy as antiviral. So this is a paper which is basically trying to look in silico assessment, like they dried some phytochemicals or phytonutraceuticals, and then they try to see if there is docking with these ligands in association with COVID coronavirus enzymes or spikes or proteins. So they found they are still working on this, but they found some natural products which could be an emerging potential COVID-19 main protease inhibitors. So protease is an enzyme which helps in the division or replication and in the division of the proteins. So this is a paper which is discussing about the target section of some uh, plants ligands with the SARS-CoV-19. This is another paper. Again, they are also discussing the same thing. They derived this spike proteins and from the medicinal plants, they could produce some phytochemicals which could be used as antiviral, and they then tried to see the molecular docking. And this is the ligands, and this is coronavirus, and they could find a good protein ligand interaction. So we can say that drugs or herbal medicines could play an important role as an antiviral therapy. So this is the first drug in the Theriac, the aloe vera or the aloe barbadensis. Again, this drug or aloe vera, some 10 aloe vera molecules were tried to see with this in silico methodology, and they found a good number of molecules of aloe vera or some phytochemicals. They are interacting with or a good structure simulation with the COVID virus, especially the proteases. So they found 6, 1, and 8 ligand from the plants, which could help as an inhibitor of the protease enzyme with a clear preference of ligand 6. So ligand 6 has the most specificity with the as an enzyme inhibitor. And this in silico technique has some rules. So this is the best binding energy minus 7.9. So this is these all are papers which is discussing about the identification of potential inhibitors of SARS-CoV-2 main protease inhibitors from the aloe vera, and these all COVID molecular docking studies. As we have seen that the docking system also suggests that aloe vera molecules may have antiviral activity, but there are already some research work in relation to aloe vera, and they found antiviral activity of several viruses like hemorrhagic viral rhabdoviruses, septicemia, herpes simplex virus type 1. So there is a long list of, and there are in silico, which suggests that it could help in the coronavirus SARS-CoV. Sorry, this is COVID-1. Sorry, COVID-1. So they already shown this aloe vera against coronavirus SARS-CoV-1. So the mechanism of this antiviral activity from the aloe vera is having interaction of virus enzyme, which helps in the breakdown the viral envelope, which does not allow the entry of the virus into the host cells. Similarly, there are papers which says that aloe vera is very rich in zinc. That is why it also has antioxidant activity, and this has an additional advantage that it could help in the or having antiviral activity, and it interfere with the DNA synthesis. So it is against both DNA viruses as well as RNA viruses. Another, as I said, I'm only looking the antiviral, antioxidant, and immunomodulators part, not the anti-inflammatory or analgesic activities. So this drug has also antioxidant property, and Dr. Limuddin Khamri was mentioning about ORAC system. So this also confirms from the ORAC and the FRAP analysis that this drug has antioxidant activities, and these antioxidant properties are because of polyphenols, indoles, and alkaloids present in the aloe vera. And hepatic glutathione uric acid levels was found reduced and restored to normal levels in the animal models where they induce oxidative stress with azoxymethane compound. And these are the papers which are discussing this antioxidant property of aloe vera. Third is immunomodulation activity with aloe vera. Again, as I said, zinc is the main ingredient which people suggest, but still there are some studies which says that it increased cell viability of macrophages, and it could help in as a first line defense against pathogens. And this is aceminin is an active substance which stimulates macrophage cytokine production, nitric oxide release, surface molecule expression, cell morphologic changes. So there are many studies and which suggest that it has very strong immunomodulatory activities, both innate means humoral immunity as well as cell mediated immunity. Here you can see that pyrogalol induced suppression of humoral and cell-mediated immune response was also found, suppressed delayed type hypersensitivity reactions in this in the mouse model. So when I was looking the details of immunomodulation or antioxidant, aloe vera is a substance or the medicinal plant which has a very good number of papers in relation to these activities. Next drug which I would like to mention is saffron or the Crocus sativus. Also, it has antiviral activity because of some crocin or picrocrocin substances which acts as anti-herpes simplex virus or anti-HIV agents. And these two substances specifically found to inhibit the herpes simplex virus replication at or before or after the entry of virions into the vero cells. And crocin, which is the carotenoid, suppress herpes simplex penetration. So many papers suggest again that Crocus sativus has the property as an antiviral activity. I'm just quoting only one paper, antiviral effects of saffron, but many works have been done in relation to again antiviral. So you will find lots of paper with this activity. Uh, this saffron also has antioxidant and free radical scavenging properties. Again, crocin is the phytopharmaceutics, which has many activities, including the antioxidant system. So they induce this stress in the ischemic reperfusion through ischemic reperfusion injury, and found a good result or regain of the ischemia, especially in the heart tissues. Crocin, quercetin, carotene, safranal, they both show in vivo and in vitro antioxidant property. Uh, Many studies also showed pharmacological and biological effects of saffron due to its antioxidant activity. Again, these are just means I'm just touching So you can find many studies in relation to the saffron and antioxidant activities. So these Theriacs, we may say very with evidence that it could be used in COVID-19. So again, as a immunostimulant, saffron uh, is an immune booster both on humoral and cellular immunity. Carotenoids is a substance which affects immunity, and there are papers that which says that subchronic doses or daily uses of subchronic doses of 100 milligram of carotenoids or the saffron, they temporarily increase the immunomodulation. So this is a paper which suggests such type of studies. So the third third drug which I would like to mention is Mormaki, basically derived from the Mecca or from Mormaki or the Comifora mer. It also has antiviral activities, and again, most of the volatile oils from the plants, they have good antiviral activities. So this Comifora mer also has essential oils. So and not only essential oils in general are effective as antiviral, but they've also seen that this essential oil from the Murmaki also provides antiviral activities, especially against influenza virus H1N1 or herpes simplex. So if it is effective in H1N1, then possibility it could be effective in coronavirus too also. This acts by causing inactivation of free viral particles and interfere with the virion envelope structures. It is crucial for the virus to enter this when we does not allow the entry of virus. Obviously, uh, this is acts as an antiviral activity. It acts by inhibiting DNA polymerase in viral strains. So it acts both against RNA viruses as well as DNA viruses. There are studies which suggest that Mormaki also has immunomodulatory effects, and it protects immunotoxicity by reducing lipid peroxidation and enhance the immune defense mechanism. So I'm not going into details like what on which uh, oxidation radicals are used, and specifically which part of the immune system is effective in such type of with such type of drugs. Mormaki also has antioxidant activities, and it protects uh, this hepatic oxidative stress was induced through lead acetate, and they found comparative with the control group that this drug has antioxidant activity even in the induction of the hepatic oxidative stress. This is another paper. Uh, this Najat Alifi is a dental surgeon, or he's practicing in state of Qatar. He mentioned in his paper that after the COVID-19, there was increased use of mirs in the population of the Qatar. So he suggested that mere mouthwashes could be effective to combat. Even in Unani system of medicine and Ayush system of medicine, they're asking as a prophylactic measures to gargle and with some Ayush medicine. So this could be an effective substance which could be used as a mouth. So he had already prepared mouthwashes with male and asking persons to use or gargle with male mouthwashes. So this is his paper, and he's discussing can male combat COVID-19. Herbal also tried like SIB that it has some ligands um, leurocyte 1, leurocyte 2, leurocyte 5, leurocyte 6, and leurocyte 7 out of many glycosides that they could be against the main protease of the COVID-19. So this is also in silico study. And apart from these 4,5 leukocyte, they also found this 3 alpha acetoxy-desma and camphorol. Camphorol is the flavonoid, and acetoxy-desma is a sesquiterpene. So these leukocyte and these camphorol, they also found very good ligand and complex with the protease enzyme. So Habulghar could also be a possible antiviral drugs. So this in silico study is designed to before the start of the preclinical trial. So it means people have started working on the drugs derived from the medicinal plants for the efficacy of COVID-19. So Habbul Ghar, not only the in silico studies suggest, but past studies also suggest that this is against COVID-1, SARS, and this again, as I was mentioning, oil are the or the volatiles or in general are antiviral activity. So this also is showing the antiviral activity against the SARS-CoV. And again, the oils from this Laurus nobilis also found effective as immunomodulation. Antioxidant properties also there with Laurus nobilis, and there are studies which suggest that the extract of this Laurus nobilis exhibits the largest free radical scavenging activity against DPPH, nitric oxide, superoxide, and hydroxyl radicals in vitro, and also in vivo against glutathione peroxidase, lipoxygenase, and catalase and xanthine oxidase. So all this lipid peroxidation when induced or in the animal models, they decrease these or increase hyperoxidation. Next drug is Gentiana or the Gentiana lutea. Again, it has antiviral activity, especially Gentio picroside is a substance which has antiviral activity, and this is secoroidoid compound isolated from Gentiana lutea, and they also try to see many of these Gentio picroside against the anti-influenza virus and found good results. This is a paper which is discussing about this anti-influenza activity with Gentiana. This is a paper which suggests cyanoprid, which is a formulated compound having many plants, including gentiana. It is commonly given in common cold or the chronic rhinosinusitis. And this is a paper which is discussing about cyanoprid and against respiratory infections. So they also found as antiviral activity in this cyanoprid. Individually, if we see Gentiana lutea oils also having antiviral activity, so this compound also suggests having antiviral activity, strong inhibitory activity against adenoviruses and respiratory syncytial virus infection. Same Gentiana also having immunomodulatory activity against humoral in response to cyclophosphamide immunosuppressed mice. uh, Shows the cellular and humoral immunity in the Gentiana. Antioxidant properties also there in the gentiana, and you can see that free radical scavenging properties against found using the electron spin resonance spectrometry, and when they are assayed through DPPH and superoxide radicals generated all these systems. So this is these are the very common markers for the study of antioxidant activities. Zaravan Tawil also has antiviral activities because of aristolochic acid, which is found binding covalently to exocyclic amino group of purine nucleotides in DNA. So we can also say that Zaravan Tawil also has antiviral activity. Zaravan Tawil also having immunomodulatory activities because studies suggest that it exhibits diminution in phagocytic capacity and macrophage cells proliferation, induce significant decline in non-specific and specific humoral immune response, in vivo immunomodulatory response of aqueous and protein extracts equally evoke dose-dependent suppressor effect on the total leukocyte counts, including the granulocytes, lymphocytes, and monocytes. This exerts the immunosuppression activities both in vitro as well as in vivo. So same plant also have immunomodulators. Antioxidant properties again with the same plant also reported because of flavonoids compounds. Kustatal, which is the Sauceria lapa. The many extracts of this compound, both alcoholic and aqueous extract, including some fractions, like here they found N-butanol soluble fractions showed the strongest inhibitory potentials on the DPPH radicals and reducing power. So they tried to work on many extracts and fractions, but this N-butanol found to be very effective. Uh, Costal also has antiviral activity. Its root extracts found against hepatitis B virus in the human hepatoma. Even in cell line, they worked against and found good effects in the cell line of hepatitis B virus. And from costonolide or dehydrocostus lactone, the main ingredient or the phytopharmaceutics derived from the cost. They are also found not only the root extract but also their active principles against the antiviral, especially hepatitis B. And even from the northern blotting analysis, they found against hepatitis A2 cell line. This same Kustatal also found having good immunomodulatory activities, especially custanolide and dehydrocostus lactone. They are the inhibitors of the T cell lymphocytes. Custanolide prevents tyrosine phosphorylation, which helps in the cross-linking of T cell receptors. And custanolide also induces the intercellular adhesion molecule. So all these helps in immunomodulator. Gonolides also studied for the structure activity relationship and found inhibitory effect towards induction of intercellular adhesion molecules and in the killing of cytotoxic T lymphocytes. So I discussed only seven medicines, especially the Kostevabai and Koste, um, uh, uh, the second one, which was the Koste, Babai and Koste, um, which is having four ingredients anyway. So from these findings, we found that Theriacs would help in the controlling of COVID-19 because it all has antiviral, improve the body immunity as well as antioxidant properties. So as I said, we discuss only the antiviral or immunomodulator or the antioxidant properties. All these drugs also has other activities which could be effective in COVID-19. So this is all from my side. Thank you so much. Since I collected stamps, I always display these postal stamps from the different countries. There are many stamps on the coronavirus also. Thank you so much for giving a chance to discuss with you about the Unani Theriacs. Thank you once
Thank you,
again.
sir. Thank you very much for enlightening that importance of the Theriacs, the historical importance, what we have come across. Most we are not aware of that the use of Theriacs among the Greek period. Of course, it is there in the literature. The Theriacs, the antidotes they used during the epidemics and the endemics. But your presentation enlightened all the modern aspect and the significance use of those Theriacs those days. Thank you for the wonderful lecture. You have covered most of the Theriacs, the description, their uses and validation with reference to the modern sciences also, sir. Thank you for joining with us for the wonderful deliberation. Let me invite the next speaker of the today's webinar. She is an alumni of our Institute Nationalist of Unani Medicine, representing from very neighbor country, that Sri Lanka, Dr. Fazina Hamid. Dr. Aisha Fazina, Aisha Fazina Hamid is also Presently, she's working as the senior grade lecturer in Institute of Indigenous Medicine, University of Colombo, Sri Lanka. She was graduated from there at the Institute of Indigenous Medicine, Colombo only. After that, she has been associated with as a postgraduate student from National Institute of Unani Medicine. She completed her MD degree Moalajat from NIAM, Bangalore only. And now she is serving in the University of Colombo as a senior lecturer, grade 1. And she in the study unit of the Ilmul Jarahat Unani section particularly. During her, she was appointed to various academics and administrative responsibilities also. She served as the student counselor, coordinator, the new entrance, PG diploma coordinator, clinical coordinator, domain coordinator for the IQAC, and also she was associated with the student support progression, etc. She's also served as the head of the Department of Allied Sciences, Unani Division, and head of the study unit Ilmul Jarahat Surgery. Madam, she will be having more than 1 decade of teaching experience and around 4 dozen of publication in a national and international journal, along with some of the abstracts in the international conferences. It is over to Dr. Fazina Ahmed for your presentation.
Thank you very much, sir. Sir, can you hear me?
Yeah, yes, please. Yeah.
Sir, can you hear me?
Yes, we can.
Assalamu alaikum. Yeah, first of all, I have to thank the Almighty Allah to give this opportunity. Alhamdulillah. Then my sincere thanks should go to the director, NIUM, Professor Abdul Wadud sir, and the organizing secretary, Dr. Alimuddin Khamri sir, to give this opportunity and to select me as one of the resource persons in this international webinar. Thank you very much, sir. The research on the topic is efficacy of Behidana, Unnab, Sapistan with Sharbate Banaksha in Nazla heart. Everybody knows that the Unani system of medicine is one of the ancient system of medicine, which is based on the concept of equilibrium and balance of natural body humus. When these humus are normal in quantity, quality, and these mixed together, then human remains healthy. The imbalance or disproportionate and irregular distribution causes disease. According to Unani literatures, this Nazla heart is a type of Amraze wabai, that is epidemic disease. So this screen not clear. I have to minimize this one, sir. That means the screen is not clear because of this.
Dr. Fazina, it is clear. You can go, please. You can proceed.
Problem is I can't read the screen because the others videos are open, no, sir. I have to minimize those things.
Take some technical.
I think that is you.
We can able to see your screen here.
Okay, sir. Okay, according to Unani literatures, Nazla har is a type of Amraze wabai, that is epidemic disease, with watery, irritating nasal discharge, sneezing, nasal congestion, redness with burning sensation in the nose, face, and eyes, lacrimation, itchy nose, itchy eyes and throat, and mild headache, excess thirst, fatigue, and alters the sense of olfaction. These clinical features of Nazla har that resemble with COVID-19 pandemic, which is the World Health Organization has declared as is a pandemic and global health emergency. So give me 1 second because here. So please give me 1 second. All right, okay. Okay. There is no direct description in Unani system of medicine about coronavirus in general, and in particular, coronavirus disease 2019, that is COVID-19, which is an infectious disease caused by the newly discovered novel coronavirus. Actually, this disease was unknown until the outbreak began in Wuhan, China in December 2019. Since the beginning of the 21st century, 3 coronaviruses have caused disastrous outbreaks of pneumonia in human beings are SARS-CoV virus in 2002-3, MERS-CoV in 2012, and COVID-19, the presenting one, that is the epidemic one, that is in 2019, which is an epidemic of zoonotic origin, spread from a single city in China to the entire country within 30 days, and spread to nearly 188 countries in less than 6 months. The causative agent of COVID-19 was tentatively named as 2019 nCoV by World Health Organization on 12 January 2020. On 11 February 2020, it was officially named as SARS-CoV-2 by the International Committee on Taxonomy of Viruses. On 12 March 2020, COVID-19 was declared as a pandemic infectious disease by the World Health Organization. It is now understood that SARS-CoV-2 has 96.2% structural similarity with the bat coronavirus and 79.5% similarity with SARS-CoV. However, its spike glycoprotein has 10 to 20 times higher affinity to human ACE2 receptors as compared to SARS-CoV, leading to more chances of human-to-human transmission, though having a lesser mortality rate, average 3.4% than that of SARS 9.6% and MERS 3.5% respectively. As of 8 October 2020, more than 36.38 million cases have been reported. That is today's report, across 214 countries and territories with more than 1.059 million deaths. More than 27.39 million people have recovered. Everybody knows that the incubation period of COVID-19 ranges from 1 to 14 days, averaging 5 to 6 days in most patients, though an incubation period of up to 24 days has been reported in some cases. That is very rare one. The most common symptoms of COVID-19, similar to nasal heart pandemic symptoms, I have mentioned here the runny nose, nasal congestion, sore throat, fever, cough. All these symptoms are similar to both are same in COVID-19 and nasal heart. Prevention is better than cure. Everybody knows that. Prevention is better than cure. As per Unani classical wisdom, improving tabiat, that we can correlate with immunity in modern. Regarding this immunity and tabiat, sir has explained very well. Yesterday also, one of our professor explained it is very well. Therefore, I no need to explain these things. Just I have mentioned here, the improving tabiat with immune boosters is one of the key approaches for prevention of disease and maintenance of health. This tabiat, actually, it is a supreme power of the body which control all physiological functions of the body and provide immunity against the diseases. According to our renowned physician Hakim Razi, people who remain physically active and exercise regularly have a lesser susceptibility to epidemic diseases. Simultaneously, patients having a weak constitution, all the people in COVID-19, especially they have mentioned the age 60, above 60 years are very dangerous, these patients. And those suffering from underlying medical problems like diabetes mellitus, hypertension, cardiorespiratory disease, chronic liver diseases, renal failure, cancer, those who are on immunosuppressive medications, pregnant mothers are more likely to develop serious illness when they infected. Unani scholars have prescribed several single drugs as well as compound formulations for the prevention and treatment of infectious diseases in general. They have emphasized More on the use of certain drugs which are known to improve host immunity during the outbreak of epidemics, endemics, and pandemics. Our objective of the study was to evaluate the efficacy of Begidana, Unnar, Sapistan with Sharbate Banafsha in Nazlahar. Everybody knows that already Thomas also mentioned these drugs are now declared as a prophylaxis treatment in India for this COVID-19. In the methodology, we have included the patient diagnosed patients between the age 12 to 15 years from both genders and who agreed to follow the protocol. Patients with atopic rhinitis, sinusitis, deviated nasal septum, nasal polyps or nasal growth or adenoids, asthma or systemic illnesses like diabetes mellitus, cardiovascular diseases, impaired renal and hepatic functions, and patients who refused to give the written informed consent for the study were excluded from the study. The study was conducted at NIM Bangalore in 2011. It was a randomized, single-blinded, placebo-controlled study. The sample size were 40. For the test group, 30 patients and control group, 10 patients. For the test group, we have given Joshanda of Behidana, Unna, Sapistandi, Sharbate, Banafsha, the dosage of 25 milliliter twice a day, orally for 15 days. For the control group, we have given caramel syrup for the same quantity and duration. Concomitant treatment was not allowed during the treatment in both groups. And the follow-ups, test day, the 0th day, 4th, 8th, and 15th day of the study. The study outcome was assessed by subjective parameters and objective parameters. As subjective parameters, rhinorrhea, fever, sneezing, nasal congestion, itchy nose, itchy mouth or throat, lacrimation, and headache. These subjective parameters we have taken, and for the statistics we have taken as a total symptom severity score. The objective parameter, especially we consider the nasal eosinophil, eosinophil, because normal in nasal secretion we don't find any eosinophil. Therefore, it is easy and cheap investigation to find out whether they have affected by Nazlahar or not. Therefore, we have selected this nasal eosinophil, which was assessed before and after treatment. The grading of nasal eosinophil was done according to this. 0 means no cells at all. That means no eosinophils at all in the nasal secretion. 1 plus means few cells or small clumps. 2 plus means moderate number or large clumps of eosinophils in the secretion. 3 plus means large clumps. After grading, the observation was correlated with the clinical findings. After 15 days of treatment, the pre and post treatment data were analyzed and subjected to comparison statistically to evaluate the efficacy and safety of treatment. In order to determine adverse effect of test drug, safety parameters like hemogram, liver function test, and renal function test were carried out before and after treatment. If we see the results and observations, these are the basic characteristics of our trial patients: age, sex, family history, whether it is positive or negative, and any allergens. These are the basic characteristics. Here, number of patients with subjective symptoms. These are the subjective parameters, and in the test group and the placebo group, here we have mentioned on the test day or 0th day, that baseline on the test visit. Out of 30 patients of test group, we had 26 rhinorrhea. After the treatment, it reduced to 5. Like that, this is in 27, reduced to 6. Nasal congestion 26, reduced to 2. Itchy nose, out of 30, it is 16 out of 30, reduced to 1. Like that, here you can observe in the placebo group, out of 10, they had out of 10 they had rhinorrhea. After treatment, it reduced to 7. If you consider these two readings, test group and placebo group, we can see here very marked, very significant reduction in the test group, and there is no significant reduction in the placebo group. Yeah, if you see here the mean subject to parameters, group, test group and placebo group, we can see here sneezing, nasal congestion, and lacrimation. These were reduced significantly on 4th day. Rhinorrhea, itchy nose, itchy mouth, and headache were significantly reduced on 8th day. Post-nasal drip was significantly reduced on 15th day. But if you see the placebo group, there is no any significant reduction, even in the 15th day, last day of the treatment. Here we have graded the patients according to the nasal smear, the objective parameter. Out of the test group, out of 30 patients, only 26 patients had positive nasal smear and 4 patients negative nasal smear. The placebo group, out of 10, 5 out of 10 had positive nasal smear, 5 negative nasal smear. This difference between the test and placebo groups was statistically significant, and I think the incidence of eosinophilia was found to increase in smears with increasing severity of sneezing and rhinos. That means if nasal smear, the eosinophilia is more in the nasal smear, mean they had more symptom, the severity more with the number of nasal smear. The overall effect of the study was determined based on the total symptom severity score of the subjective parameters. If you see here, the effect of drugs on total symptom severity score, the test group before the treatment, it was 9.6. After treatment, it reduced to 0.9. That is very extremely significant reduction. But if you see this placebo group, there is a reduction, but it is not significant one. And I think if we compare this with the test group, shows very significant with respect to the test before treatment and placebo. Placebo after treatment also. This is effect of study on nasal smear for eosinophil. In the test group, before the treatment, in the test group, it was 1.73. After treatment, it has reduced to 0.02. That also very significant reduction. In the placebo group, it was 1 before the treatment. After treatment, it has reduced to 0.6, but it is not that much of significant. Here, this is very significant. That means p-value less than 0.001. And you can see here the before treatment, more eosinophil. After treatment, not even a single eosinophil. This overall effect on the study based on total symptom severity score and nasal smear for eosinophil. Here in the test group, 26 out of 30 were positive nasal smear and 4 were negative nasal smear. The total symptom severity score was 9.6. After treatment, 1 patient still remained as positive nasal smear, but that also very less number of eosinophils were there. Was there. Total symptom severity score, it was reduced to 0.9. If you see the placebo, 5 out of 10 positive and 5 negative. The total symptom severity score was 7.8. After treatment, the nasal smear for eosinophil they remain as same, but total symptom severity score reduced little. Okay, here also it is very significant effect. This drugs very significant effect on nasal smear for eosinophil. If we see the overall effect on the study in terms of response, this response, when we talk about this response, we have taken by two, one from subjective parameter and the objective parameters also. If the subjective parameter, that is total symptom severity score, is 0 to 2 or less than 2 with negative nasal smear for eosinophil, or significantly reduction of nasal smear for eosinophil considered as cure. Like that, not cure mean the total symptom severity score 2 or above 2 and negative positive nasal smear for eosinophil. According to that, the test group out of 28 out of 30 got complete cure. Only 2 not cure. That also not complete cure. That means they reduce their symptoms very significantly, and the nasal smear for eosinophil also reduce in numbers. The pre and post treatment data from both groups were compared. This group has shown statistically significant reduction with P less than 0.01 in the severity of subjective parameters, while in placebo group remain insignificant till 15th day. The objective parameter nasal smear for eosinophil was found extremely significant in test group in comparison to placebo group. Furthermore, the study has shown no significant adverse effects were observed during the course of treatment in the test group, and overall compliance to the treatment was commendable. Therefore, we can, in the conclusion, the overall improvement in the disease reflected in the form of regression of various symptoms may be due to the temperament and different pharmacological effects of the drugs, like dafenazla, mufarrik, mulatif, musakine hararat, kabis, mufatik, munzige ahlate khaliza, mulayine akhlate rafiqa, munafise balgan, muhalile varum, muaddile safra, ta'adilud dam, lazujat, and muratibba munavin of test formula Behidana, Unnab, Pakistan, and Banaksha. The beneficial effect of test formulation is corroborated by the use of these drugs in a variety of respiratory diseases by Unani scholars is in consonance with the pharmacological actions of drugs described in Unani literature. But some scientific evidences are there. These drugs, the Behidana has antioxidant, immunomodulator, anti-allergic, anti-influenza, anti-inflammatory, inhibitory effect on broad range of the late phase immune reaction of mast cells. Like that, Unna possesses anti-allergic, anti-inflammatory, anti-influenza, immunomodulator antioxidants. Sapistan has immunomodulator properties, anti-inflammatory, tracheal smooth muscle relaxant, antioxidant, analgesic, expectorant. And Banaksha has the properties of anti-inflammatory, which is equal to corticosteroids in the treatment of inflammatory conditions of lung, antioxidant, anti-asthmatic, sedative, and antibacterial also. By these evidences, and from the results and observations, the test group showed good response. So it can be concluded that the test drug is effective in reducing the symptoms of Nazla heart. Already we told the symptoms of Nazla heart resemble COVID-19. Therefore, I can suggest here this formula we can use effectively and safely in the prevention of COVID-19 symptoms as a prophylactic measure. Already the Indian government, they have declared these drugs as a prophylactic measures in the COVID-19.
8 days. Follow up.
Okay, thank you very much.
Thank you, Dr. Fazina. In fact, this study is conducted under my supervision only. Before the publication of this, in fact, nowadays the government of India, when they are going to announce the drugs Vedana, Unnab, Sipistan as a prophylactic medicine, they couldn't find any published study on influenza-like symptoms or the Nazla. Because this study was published offline journal of the Sri Lankan journal, which is an indexed journal by the government of Sri Lanka under the Colombo University. You can access that one also. This was the study we thought have some viral like infection, influenza like symptoms were there, and the results were promising what that author was trying to present here, convince here. Thank you for the presentation, Dr. Fazina. Now we have the next speaker with us, Dr. Mariam Khat Khasani from Iran. Dr. Mariam is from the field of chemistry. She specialized in the BSc chemistry, followed by Master of Sciences in chemistry and a PhD in analytical chemistry from Iran Khasan University. Madam has worked since 2003 to 4 as an analytical chemistry lecturer in the laboratory for University of Khasan, Iran, followed by since 2009 to 15 as an analytical chemistry lecturer, course and labs, Khasan University, Medical Sciences, Khasan, Iran, and followed by 2013 to 15 as a general chemistry, Faculty of Health, Khasan University of Medical Sciences, Khasan, Iran. Madam is an analytical chemist, and now she's having more than the 2 dozens of publication in different journals, and presented papers and conferences. Around 10 number of papers are presented in international conferences. With this brief introduction, I request Dr. Mariam Khat Khasani, this is over to you for your presentation, please. Please, share करिए madam. Now we are going to share this, please.
Yes. چطور میتونم برم صفحه بعد ببینم؟
Now we can proceed, Dr. Mariam, a little.
Thank you. Hi, Dr. Alamuddin, I'm glad to have the chance to share my information about COVID with you. I thank you. I'm talking about using a herbal metal formulation of nanosilver with formulation on nanosilver with violet active ingredient including quercetin, luteolin, and lutein. We have first talk a little about the theory of the effect of nanosilver as an antibacterial and antiviral, and then move to their molecular docking studies. The topic discussed are as follow. Different application of a silver nanoparticle. I cannot do next slide.
Next slide, please.
Next slide. My most unable to. Next slide.
Now your screen is visible, Dr. Mariam, from here. You can,
yes.
Yeah.
Okay.
Next slide.
Okay. Silver nanoparticle, however, is a medicinal application in clinical and application in surgical, one therapy, and other. In this figure, various medical applications of silver are antiviral, antifungal, anti-inflammatory, anti-aging, anti-tumor, antioxidant, and other application that you see. Antibacterial activity of Ag nanoparticle. The antibacterial properties of silver nanoparticle have made them very popular today. They are many products in topical consumption. The relation between the size of Ag nanoparticle and the antibacterial effect has also been elucidated, indicated that a smaller diameter results in a higher bactericidal activity. Silver ions are known to especially react with the thiol group of cysteine. Thus, the metabolic enzyme inside to bacterial are considered to the inhibition. In this figure, some of these proposed mechanisms include one, the direct contact between nanoparticle and the microbial cell, which disturb the power function of the cell membrane and cause structure damage. To degenerate of reactive oxygen species, ROS, which damage the cell membrane, and in the interference with DNA replication and inhibition of enzyme and other protein. The effect of nanoparticle, one of the most important effects of silver nanoparticle that has been studied in is its antiviral effect. The effect of silver nanoparticle on the virus HIV was investigated in this study. Another study, the effect of silver nanoparticle on H1N1 influenza was investigated. This study presents evidence for the antiviral properties of silver nanoparticle. The soluble silver nanoparticle were active against H1N1 influenza A virus, which is represent commonly for infection. The findings suggested that silver nanoparticle can provide enhanced protection against influenza virus infection without the risk of cell toxicity. The effect of a silver nanoparticle on RSV also was investigated, is an important etiology agent to respiratory infection in children for which no specific treatment option is available. In most cases, a direct interaction between the nanoparticle and the virus surface protein could be demonstrated as a hypothesis. The intriguing problem to be solved to understand the exact site of interaction and how to modify the nanoparticle surface characteristics for a broader and more effective use. Besides the direct interaction with viral surface glycoprotein, metal nanoparticle may gain access into the cell and exert their antiviral activity through interaction with the viral genome, DNA or RNA. Most of population literature described the antiviral activity silver nanoparticle against involved virus with both a DNA or an RNA genome. The effect of silver nanoparticle. In addition, in transalginal silver nanoparticle administration in mice significantly enhanced survival after infection with H3N2 influenza virus. Mice treated with silver nanoparticle shows the lower lung viral titer level and minor pathogenic lesion in lung tissue. In this figure, negatively strength H3N2 IFV particle were observed by TIM to illustration the interaction between silver nanoparticle and IVF. The IFV controlled approximately 120 nanometers, show typically elliptical spherical shape. Norm IFVs contain viral matrix and capsid. While part of the viral morphology structure was almost destroyed after 120 minute interaction. This result showed that silver nanoparticle can interact directly with virus particle and destroy morphology viral structure, leading to disruption of viral function in a time-dependent manner. Also, the silver nanoparticle were uniformly distributed with particle size less than 20 nanometer, and two types of silver nanowire were 60 nanometer and 400 nanometer in diameter, respectively. The average diameter of the silver colloid was approximately 10 nanometer. Results showed that silver nanoparticle and silver nanowire described the number of apoptotic cell induced by TGEV. In this figure, this table, interaction of nanoparticle and possible mechanism has been reported. As can you see, for HIV, HSV, HPV, and metal, silver nanoparticle, gold nanoparticle, and coating and mechanism of action is described, and size the nanoparticle. In this section, experimental method, synthesis of silver nanoparticle as a herbal metal nanoformulation is described. In this method, experimental, the silver metal oxidized at the anode and turned into silver ion. The growth of silver crystal on the cathode surface in presence of herbal reduction including luteolin, quercetin, and rutin causes the formation of agglomeration silver nanoparticle with a size less than 40 nanometers compared to the two other non-electrochemical methods. This method was non-require expensive and advanced equipment and can be usually prepared in this figure. Cathode is still 360 pharmaceutical grade. Anode is silver metal. By applying voltage, the following reactor occur and electric current is continuously increased. To reach a saturation level in the synthesis of this nanoparticle, silver is oxidized and silver ion are formed at the anode electrode by applying voltage. The reaction of water oxidation and the formation of oxygen also occur. In the next step, the silver ion positive ion migration to the cathode, which is still a negative pole. At the cathode, silver ion are converted to neutral water. This herbal reduction also established and protocol from in this figure, FESEM, field emission scanning electron microscopic, is one of the most powerful for description nanostructure system. This image shows an almost cubic particle shape. The average particle size is 20 to 50 nanometer, which confirm the result of the XRD method. Here we have a comparison between the size of nanoparticle and the size of virus. If methods such as FTI are used to confirm the functional group of the plant compound effective in making silver nanoparticle, for example, stretching mode of carbonyl to the functional group. This functional group might play the role of synthesis and stabilizing silver nanoparticle. XRD is used for confirm the crystal structure, nanoparticle formation, and also the nanoparticle size. Also, UV visible is used to confirm the synthesis and size nanoparticle and the stability of nanoparticle. Section 3, in a silico study of herbal metal nanoformulation, silver nanoparticle, and viola odorato or banafshe in Unani medicine constitute luteolin, quercetin, and rutin on treat novel coronavirus based on molecular docking. In this section, computational chemistry explains the formation possibility of chemical bonding between atoms. Molecular activity in thermomolecular dynamic, chemical reaction formation possibility in the scope of thermodynamic and molecular orbital theory, taking into consideration valence orbital interaction and potential energy molecular orbital. According to the DFT Koopman theory, the electron affinity and ionization potential of a molecular can be expressed in terms of its HOMO and LOMO orbital energy. The distribution pattern for FMOE for luteolin and quercetin and routine it was investigated. For example, shown in this figure, in brief, for luteolin that has the best MOLDAC score for inhabiting COVID. HOMO and LOMO have the uniform distribution of peak load in all our molecular. Detail of HOMO and LOMO energy, luteolin, quercetin, and rutin, along with their gap and reactivity indicated, are listed in this table. This number emitted. Among all bioactive compound, luteolin and rutin show the lowest energy gap. The highest electronic chemical potential value is for rutin, and luteolin show the lowest chemical potential value. Investigation of this factor is very important in determination of mechanism of redox reaction between silver ion and plant component, and also for investigation the docking of this molecular with COVID. Molecular electrostatic potential, or MEP method, is a very useful approach to explore the reactivity of compounds such as electrophilic and nucleophilic reaction, as well as hydrogen bonding interaction. It provided a visual method to understand the polarity of the molecular and mapping of an electron density isosurface with electrostatic potential surface, the surface, the size, shape, charge, density, and site of chemical reactivity of the molecular. The nucleophilic and electrophilic in any compound are expressed in terms of different color code. A deep red color indicated an electron-rich site, which deep blue indicated an electron definity site. MEP result from calculation of quantum mechanic approach with Hartree-Fock method for luteolin, quercetin, and rutin, as shown in this table. It is clear that electronic density in luteolin and rutin is concentration in hydrogen in position 8 of ring A, and 4 and 6 in ring B, and oxygen in ring C, indicated that this site of the molecule are nucleophilic. In the other hand, the hydrogen of the hydroxyl group in position 3 and 4 of ring B, and 4 and 7 in ring A are electrophilic. The quercetin, luteolin, and rutin oxidation mechanism is shown in the figure. This mechanism is consists with the information obtained from MEP study, the electron needed to regenerate silver ion and convert them to nanosilver and supply through this reaction. The molecular docking play a strategic role both in pharmaceutical studies and in drug design. The rigid flexible molecular docking was carried out by the Molegro program. In the next step for the preparation coordinates file of 3CL protease and drug structure, the first of PDBQ create. We investigated in the interaction of viola adorated or Banach active constituent such as lutein, quercetin, and rutin, quercetin, and luteolin with 3CL protease computational and using molecular docking technique as indicated in this figure. In the interaction of all compound with target were observed the H bonding interaction between glycine and aspartic acid and theanine and methionine. We observe in the binding site amino acid site. In the mast K rule, hydrophobic and H bonding interaction are in the complexation process due to hydrophobic nature of the COVID protein or 3CL protease. It can conclude that the interaction of main protease or target with hydrophobic and insoluble compound is better than water soluble compound. In this figure, luteolin 3Cl protease form a hydrogen bond interaction by active site residue, aspartic acid and theanine are described. Quantum mechanics calculated that show that luteolin has the lowest LOMO energy among selected bioactive compound that lead to its potential to act as an electrophilic. The highest electrophilic index among compound confirm that this conclusion. And in this figure, quercetin 3Cl protease form hydrogen bond interaction by active site residue cysteine and aspartic acid and sericin, and theanine is investigated. Interaction supercell of Ig nanoparticle of SARS-CoV and 3Cl protease present in this figure. Steric interaction with leucine, aspartic acid, and sericin is indicated in this figure. These are supercell of Ig nanoparticle. Aromatic charge and hydrophobic surface of Ig and 3Cl protease complex, and H bond and solvent surface of Ig nanoparticle with target 3Cl protease complex. And in this table, the calculation binding free energy and relevant inhibition constant are present in this table. Complexation quercetin, luteolin, and rutin as active constituent of violab with anti-inflammatory, anti-pyretic, antiseptic, and antiviral properties with target have just about the same binding site as observed in this table. Rutin has the minimum binding energy among other compounds. This could point to the relatively similar interaction of this drug compound with this protein to inhibit function or 3Cl protease. In this work, the minimal binding energy for representative from result of the base pose of interaction observed between routine and target is observed in this chemical compound 3Cl protease complex and active amino acid are including hydrophilic residue such as cysteine, methionine, for example, proline, and glycine. According to traditional medicine, the symptom of this disease mainly originate from hot and dry treatment, including high fever, dry cough, and dyspnea. As the result, it seems reasonable to use cooling agent for relieving the symptom. Silver, which is called fezze in Qarabadin and Makhzanul Adwiye, is a famous metal with a cold and dry temperament and has astringency and the desiccating faculty. Silver solution is better than insoluble silver in all property and medicinal function. According to the source of traditional medicine and the antibacterial and antiviral effect of silver, which was mentioned, a solution of nanosilver in violet plant compound indicated including luteolin, quercetin, and rutin was made, and the set was examined for molecular docking study. Based on quantum calculation and bioinformatic tools, molecular docking was performed to identify novel compounds having the potential to bind target of SARS-CoV. Based on the result of the present study, it can be concluded that silver nanoparticle and violet constitute luteolin, rutin, and quercetin strongly bind to terrestrial protease of SARS-CoV and promote critical structure change in this target. It is recommended that this green active compound, due to lower side effect of natural product and the possibility of using higher dose of drug and their known antiviral properties as model drug for experimental and theoretical study to evaluate their possibility antiviral activity. However, further study shall be conducted to validate this compound using in vitro and vivo model to pave the way this compound in drug discovery. Clinical study of this drug with name CoronaGuard, a drug formulation on the basic by Tuba Pharmaceutical Company in Iran, were performed in 3 hospitals in Tehran by Iran University of Medical Science and were very successfully in improving the complication of this disease, especially in outpatient. The article of this study will be published soon. Thank you for your attention. Also from Professor Ismail Nazem, who was in charge of this research, and my colleague, Dr. Ebrahimian, Dr. Ghorbani, Danush Azagin, and Mr. Ansari. Thank you.
Thank you, Dr. Mariam Khat, for sharing the novel idea about this, a combination of what is called as nanoparticles of fizza along with the banafsha herbal preparation. As per the science of the Iranian Persian medicine, though we have the description of the use of the banafsha and the nukhra, the so-called the fizza, in several formulation for different indications. But this is a novel idea, what you are using, and according to your study, it is intended to have some effect as an antiviral effect. It can be used in some of the viral infection, include COVID-19 also. Thank you for sharing your novel idea with all our august audience. Thank you. Let me take a privilege to invite our next speaker, Dr. Nazrul Islam, Dr. Muhammad Nazrul Islam from Bangladesh. He's a former student of the National Institute of Unani Medicine, Bangalore, as an alumni of our institute. He completed his graduation, Bachelor of Unani Medicine and Surgery from University of Dhaka in 2002, followed by Master of Philosophy in Nutrition, Food Sciences in 2015 from Bangladesh. Then between 2006 to 2019, as a PG student in Preventive Social Medicine, Tahafuz Samajit from National Institute of Unani Medicine. This is about his academic career. And over the last 13 years, he worked in different capacities in the government services of Bangladesh. Presently, he is working as assistant professor in the Department of Unani Medicine, Faculty of Unani and Ayurvedic Medicine in Hamdard University, Bangladesh, between since 2014 till date. Before that, he worked in different capacities in government of Bangladesh. To Nazrul Islam's account is an award which is he received this award from WHO TDR Asian Scientist for 3rd ABTC in India during 2000. He is having more than 15 publications of national and international repute, 10 papers in national and international journals. He is an author for books like Strategic Development of Herbal Medicine, Research-Based Approaches, and Introduction of Regimenal Therapies, and moreover, LF filariasis and Epidemiology, Treatment and Prevention, the Indian Perspective. These are all the publications of Dr. Nazrul Islam. He is also holding the membership of the agencies like Chronicle Publisher, Science Pet Journal, Natural Products, Current Research in Complementary and Alternative Medicine, MedPlus Journal of Botany and Plant Biology. And moreover, he is the reviewer of some of the journals like Journal of Nutrition and Food Sciences, Journal of Bacteriology and Parasitology, International Journal of Biology, Advanced in Pharmacognosy and Phytomedicine. He is a member of the International Society of IRED USA and BARA from Bangladesh. It's over to Dr. Nazrul Islam for your presentation.
Sir, are you hearing me, sir?
Yes, sir.
Hello? Sir,
Share.
are you showing my presentation?
No, it is not visible, sir.
Okay, sir. Yeah. Hello.
We can hear you, Dr. Nazrul Islam. Share your slides, please. Meanwhile, let me, while this information, all our participants, please stay with us. In the next couple of minutes, we are going to release the feedback form. We are expecting the positive response from your end. Soon after that, you will be receiving the participation certificate to your respective.
Sir, are you hearing me, sir?
Yes, Dr. Nazrul,
Sir, problem is that there is some sharing problem, is there?
you please.
Just sir, are you showing? Sir,
Get Dr. Nazrul.
sir, are you showing my presentation?
No.
Oh, sir. Sir, is it showing now?
No.
Just share the screen.
Share your screen, Dr. Nazrul.
Yes, sir, I am.
Bottom.
There is one option is there. Share whiteboard camera, bookmark, document, photo, Google Drive.
No, there you share your PPT. You're getting all the other options. No white camera. Go to share screen. From there, probably your PPT is open. You just click it.
Yes, sir, I have done there.
Dr. Nazrul, first open your PPT, your screen, sir.
Oh, sir, I have
Yeah.
opened it.
You first
So,
open your presentation, then go for the screen share.
sir, are you showing me my presentation, sir? Now?
No, it is not visible, sir. Otherwise, you can read it now, Dr. Nazrul Islam.
Yes, sir, I am reading.
Yeah, please start.
Yes, sir.
That's also the way.
Yes, sir, wait a bit, sir. I'm trying.
Yeah, this
Yes,
is also
sir.
the way you can share with.
Yes, sir, it is, yeah, I'm sharing. Okay. First of all, I would like to thank Professor Dr. Kamble, sir. Professor Dr. Wadud, sir, is the director of the National Institute of Unani Medicine. All my teachers who are nurturing the National Institute of Unani Medicine. and all my colleagues, participants, juniors, and staffs of the NIUM. I am Dr. Mohammad Islam. I am going to now present my presentation. My presentation topic is present scenario and strategies adopted to combat COVID-19 in Bangladesh, Unani perspectives. First of all, I would like to share that is some question COVID-19 Bangladesh scenario. As you see this in first cases found in Bangladesh, is index case was 8 March. It is in 2020. After that, it is dramatically increased. After 3 months, its case was around 1,19,000, and now it is in around cases, positive cases was 3,73,151. And there is a mortality case fatality rate is dramatically increased. Now it is around, first it was in 0.38%, now 1.38%. In Bangladesh, if we see this, there is a test conducted around 2,01,437. Test positivity rate is 18.5, and COVID test around lab is 109. And maximum prevalence was observed in the age of 31 to 40 years, around 26.7%. Maximum death 61 to 70 per years, and 31 to 31.2%. Sex almost male are more affected than female, and death usually occurs in 61 to 70 years more. Male was 31.6 and female was 30%. Maximum case was in city-based Dhaka city. If we say this discussion, the mode of transmission is almost same as the here aerosol transmission, droplet, fomites, and adventure. But here is some important things I would like to share with you. There is some orophageal route, blood, tear of fluid smell, tear and body fluid. Viral alarms also detect in feces and sewage water in the quarantine area of Bangladesh. Some of the areas, they are one of the study conducted in Noakhali Science and University. They found that the quarantine area, they collect the feces and show that there is a viral RNA in the feces, sewage water. So after COVID pandemic, the Bangladesh has developed international policy to control the clinical management of COVID-19. COVID-19. They developed a guideline in 20 May 2020. After that, one of the I would like to share is one of the important is that there is a diagnostic we are using this for this RT-PCR. One of the gold standard nucleic acid amplification test, antigen rapid antigen test, and rapid antibody. One of the renowned scientists of the Vision Commercial, he discovered the serum antibody within short time. In 30 minutes, it can be diagnosed. He is also pioneer of the SARS-CoV-1 antibody. He is a Bangladeshi working in Singapore. Now he is in Singapore. So what national guideline to show this, that is a different categorized into different type of symptomatic. There is mild, moderate, severe, and ARDS and septic shock. They described in for clinical management. Most of the symptoms, there is fevers, cough, some throats, malaise, and nasal congestion, almost similar to all of the world. But here is what we have done, and there is the rest of the almost all cases of home isolations, social distancing of family members, no as visitors allowed, hand wash 20 seconds, and cough etiquette, and symptomatic treatment of paracetamol, antihistamine, serum inhalation of the steam inhalation, and follow-ups home treatment for 14 days. If it is almost cases are resolved naturally, but some cases is going to be it is in critical condition, then it is hospital. Especially moderate and severe cases are hospitalized. And moderate case was clinically defined as the severe respiratory symptoms and almost radiological findings of pneumonia. And there is oxygen if needed, pulse oximeter there, so this is 90 more than 90, less than 93%, and they are given the oxygen supply. No treatment of sometimes some patient no need to oxygen supply. If needed oxygen, they given body specific antibiotic, flavivir antiviral, some other low molecular heparin. They are also used to clinical management of the moderate type of patients. And some of the patients, especially around 1% of cases severe pneumonia who develop and require to SDU, ICU, and moderate treatment of methyl prednisolone, remdesivir, and tocilizumab, and they are also convulsive plasma therapy. There is one I would like to emphasize one of this is a tocilizumab is a cytokine, cytoprotective. Thus, it is also in some of the Unani medicine, which is the cytokine properties, especially Artemisia is having the cytokine properties, the cytokine modulators, and it can be, we can give the some special emphasis on the Artemisia. Here is some of the traditional doctors also in Africa, they also try to convince the WHO to allow the Artemisia to use in the COVID-19. So it is of the one of the important thing is that we can discuss about that Artemisia to use the COVID-19 situation. There is a, I would like to use the Unani concept of some basic concept of amalgamation, imbalance of four humors, air, water, earth, atoms. The cure that sickness removed all the humors there. In especially Hippocrates discussed the imbalance of four humors in the developed disease. The cure of the sickness was to remove the air humors and in the question to balance the body. This belief led to the application of blood letting and dieting in the medicine, and he also discussed the causative factors and treatment of disease. Galen believed that illness was caused by an imbalance. So, how does one restore the balance? Bleeding, enemas, and vomiting, concept of contagion. And is our Prophet Muhammad also said, if you hear about any outbreak, such like a plague in a land, do not go to it. And but if plague breaks out in a country where you are staying, do not run away from it. So it is the indication of the quarantine. One of the scientists of the Raji, he was a humoral theory, and he will give the right the smallpox and measles, differentiate the different epidemic diseases, especially differentiate to how we differentiate the smallpox, measles, and other epidemic diseases. Ibn Sina proclaimed that 40-day period of quarantine was essential to weaken the spread of contagious infection, period of quarantine, and more CDC described the epidemic as a disease more than expectation in that area. So what we have think that we have concluded that our Unani ancestors, Unani philosophers, described the three important factors as interest environment, as we know, the epidemiological threat, but they are describe the different environmental, seasonal cyclicity, environmental variation, temperamental variation, morbid humor, host response, and agent and time, and that time. So it is the time now to discuss to conduct the research on that the environmental factor, how involved epidemics and seasonal cycles, how responsible for the epidemics, and how host response is responsible for this epidemic, and as in host time. One important is Ibn Sina also described the warm and most water influence the epidemics, and individuals with hot and most temperament force are more prone to books there. If one of the Theriacs, Faruqi is very, if you take in healthy state and you are not going to the epidemic, and you will become healthy during the epidemic. So it is needed to discuss about this, to conduct the research, how it can be applied with the limitation. In Bangladesh, if we see what are the treatment trends to receive treatment of COVID in Bangladesh, almost people in especially complicated cases, they take the allopathic medicine, Unani medicine, then Ayurvedic medicine. And on the basis of mild and moderate cases, almost people take Unani medicine and Ayurvedic medicine and allopathic medicine. So there is especially influenza-like illness and mild level, they are used the Unani Ayurvedic medicine and home quarantine. There are also some natural medicine they also take. but in complicated case, they have to shift to the hospital for emergency management. So strategies adapted to combat COVID-19 in Bangladesh. If we see this, there is I can divide it into three platforms: private, public, and others. Private government have given a strategy, especially government Unani Ayurvedic Forest government has taken the alternative medical care faculties, where activities in the whole of the Bangladesh, especially in the government Director General of Health, there is a alternative medical care, development of information, education and communication system, community model. They are playing the vital role in development of information, education, communication to increase the awareness of the community, and especially using this some traditional medicine to combat the COVID-19. Unani Ayurvedic, a non-government organization, especially I would like to emphasize here, there is Hamdard University, Hamdard Laboratories, Hamdard Work for Bangladesh, and Hamdard Foundation is one of the non-government organization. He is playing vital role to control to develop the Unani system of medicine in Bangladesh. Here is I will show this some academic activities in university, academic colleges there, and some research institute who are conducting the research to go for COVID-19. If you see this, there is some, I would like to show there is on 50 patients documented that 50 patients develop any complication of the negative after 14 days of treatment or Unani treatment in the Hamdard Center, and more than 7,000 quarantine cases were treated with Hamdard medicine. And they are applied Kuljum, syrup, Alvacin, syrup Saduri, and Joshina, and sometimes the Pevnil, and especially Puljum also there. So three medicine they have some very positive response, especially who are positive. They are after 14 days of treatment they take negative. So it is documented, but it is there is some clinical trial is required to prove this scientific efficacy and safety procedure. But as you all are known, especially Kambisar and others also described that there is a Bihida now in Pakistan. Koranjua has a COVID against antiviral activity and immunomodulation activities. There is some strategy active government on answer for this home-based remedies. There are also there's some installation, gargles, natural home-based treatment. And government studies national-wide isolation, quarantine center, training capacity build up to service providers, COVID-19 hospitals, secondary district level hospital provide treatment, and private hospitals specialized treatment for COVID unit, different national and international NGO working to increase awareness to the community. Private company like Hamdard Laboratory or Bangladesh provide the best treatment, free treatment to the COVID-19 patient, more than 30 outlets or 27 treatment outlet center in Bangladesh. They are given the free of treatment to the COVID patient and COVID-like illness or anything the like illness patient. What is the limitation is that it is very important with it is very difficult to conduct research because we have no biosafety level 3 lab or no national institute of virology like who are going to research especially in viral emerging and emerging diseases. But there is IEDCR and government ICDDR, some they are trying to conduct the research and they have lab facilities, and lack of research and development, even the Ayurvedic Research Council, technical and financial support, especially lack of expertise and a specialized hospital is a very important factor because there is most of the complicated treatment hospital based, or if your hospital expert is very poor, that's why mortality is also high in the complicated cases. So here is some recommendation is that prospective recommendation to combat COVID-19. It is my Unani classical textbook and other relevant manuscript. We have to extensively research. Here I have to here I would like to thank to Professor Zulkifli sir and others who are published the international journals, their articles about the extensive literature concept of Unani medicine and epidemics, and other my teachers. Unani classic textbook, we have to extensively survey Unani classical textbooks and other relevant manuscript, especially international journals and literature sites. And important is that ancient Unani formulation Theriac alpha, I have also discussed about it. There is especially mentioned in the medicinal alternative. If you take this Theriac alpha during the epidemic, you will not be any develop any side effect or any complications. So we can discuss about the clinical trial Theriac alpha if it's possible in multi-country studies. And the methyl absinthe, I have already discussed absinthe having pro-inflammatory cytokine modulatory effect, especially interleukin 1, interleukin 60, and then alpha. If we modulate the pro-inflammatory cytokine, the symptom will not be developed. So it is one of the preventive and curative treatment, maybe curative treatment for the absinthe. It is needed to conduct a clinical trial and transfer coricolia, longa, satistan, all having the antiviral activities and especially COVID for COVID-19. And if any new formulation is required, then we can conduct this randomized clinical trial and multi-country, multi-center study is needed. And what strategy it is very important. How I think it is an international conference, international event, a lot of scientists are there. So if it is conduct all of whole of the international level, and we can develop an international Ayurvedic treatment guideline for COVID-19. Other not only COVID-19, it is other emerging and re-emerging diseases to form or involve ensure active participation of WHO because WHO playing vital role. So here as traditional complementary alternative medicine, we can involve the WHO and they can allow to discuss conduct the clinical trial. And especially I would like to emphasis on Southeast Asian and Regional Council is required because India is playing important role to development of the Ayurvedic system in the Southeast Asia region. So India can take the leading role for the development of the activation of the Southeast Asia Regional Council, where we can follow the same regional guideline to any epidemic or any emerging diseases. International Scientific Advisory Committee is required to develop approval of Ayurvedic traditional complementary to combat the COVID-19. And finally, political commitment by government is important because the financial financial constraint is also there. A strong surveillance system to control release of lab-modified virus or pathogenic organism by terrorism by who because it is not only established yesterday. As also research has described that there is now the bioterrorism. A strong surveillance to control release of lab-modified virus or pathogenic organism or viruses by WHO. And there is some technical problem, but I would like to discuss, especially I would like to acknowledge one of the greatest legendary in Bangladesh, our Dr. Habib Muhammad who established Hamdard University, Bangladesh. It is a nice one of the providing university, one of the leading university, private university in Bangladesh. So I would like to invite you to visit this university, Hamdard University, Bangladesh. It is one of the nice place. He's also one of the best personality in one of the renowned personalities in Bangladesh. I would like to all to who are come to Bangladesh and visit the Hamdard University. And thank you all. There is some technical problems. I cannot share technically fully. Thank you so much for all the participants, all my teachers, and for who are participating in this conference. Thank you. Thank you, sir.
Thank you, Dr. Nazrul Islam, for the wonderful information. Though there is a technical gap is there, but you made it very wonderful. The verbal presentation of the content was, I hope all the audience have listened to your presentation. The initiation what you've taken at the Bangladesh level to combat this COVID-19 is also it's appreciable. And now with this, we are going to conclude the international webinar day second. Thank you all the panelists joining with us and all the participants with us. As organizing secretary, it is my job to recapitulate the webinar. The 2 days international webinar came to an conclusion. It is my duty and it's a privilege to extend my vote of thanks to all the panelists, the invited speakers of today's sessions. My greetings, my thanks are due to Professor Syed Ziaur Rahman sir. Though he is a busy, he spent much of his time with us since yesterday. Today also he was with us. His delivery is wonderful. He covered all the historical aspects of the Theriac, the antidotes of the Unani medicine. And he enlightened the scientific studies and the reports of all the ingredients of the Theriac. Sir, thank you for bringing such a wonderful information to our audience, and panels also equally enjoyed with your knowledge what you have shared. Thank you for with us, sir. I'm very much thankful to Dr. Mariam Khasani because this is a novel kind of, a new kind of understanding for us. It is something like a metallic and herbo nanoparticle study. As she told, that is the concept of this formulation is from the Iranian Persian medicine. It is a novel idea for all of us. I think Unani people here in India, we are not doing that kind of preparations. I think it will be discussed with the authorities. But the outcome, we are expecting the documented outcome in any viral infection, but more particularly if it is in COVID, please share with us so that we can think of, we can go for further studies also. Thank you for joining with us, Dr. Mariam Khasani. You spent the last 2 days with us and you have shared the valuable information with us. Thank you for joining with us. Thank you. Thank you. And my thanks are due to my student, Dr. Fazina Hamid. She is a senior lecturer from Institute of Indigenous Medicine, Colombo University, Colombo, for presenting her own clinical trial. That study was conducted somewhere back 5-6 years. Now today, the drugs what we used in that study is being promoted by the government of India as a prophylactic medicine in controlling the COVID-19. Thank you, Dr. Fazina, for sharing your knowledge and being with the part of this program. Thank you. My thanks are due to Dr. Nazrul Islam, who is supposed to be the last, and that there is technical lag which makes us to be not to share complete presentation, but the content of the presentation was very informative, and the verbal presentation is also, I hope all the people have enjoyed. Thank you, Dr. Nazrul Islam, for sharing your knowledge. And I think because of the technical problem from permission, not Dr. Muhammad Kamil sir was our first speaker of the today. On behalf of him, so he extended his greeting and regretted for not the part of the program. For him also, I extend our sense of gratitude, sir. You are because of this official engagement only, you could not be part of our presentation. I extend my thanks to you. My thanks are due to the yesterday's speakers. I am very much indebted to all the speakers of yesterday. Professor Ravi sir, being a head of the institute, head of the Department of Neurovirology from a globally reputed premier institution, who shared his wonderful knowledge on the virological aspect of the SARS-CoV-2. Of course, his speech, his content motivate us, because the immune system of the people are talking about immunity related thing. Of course, his words like the seed is nothing, but the soil is everything. We remember you, sir. All the content, all the information, all the knowledge what you have shared is very worthy, valuable. We are really grateful to you, sir. I extend my greetings, and on behalf of all our members of the committee, the chairman, the director of the institute, we are very much thankful to you, sir, for sharing your knowledge with us, and we'll be in touch with you for future prospects of the courses and anything else. My thanks are due to Dr. Giridhar Babu, who is a professor of epidemiology working with the Public Health Foundation of India, Bangalore, who shared an elaborate discussion about the epidemiology of the SARS-CoV-2 global aspect in general and very specific to the Indian epidemiological data. Sir, I'm very much thankful to you. I know that you are busy with all nowadays because with the COVID task-related activities of the state government of Karnataka, but you spend your valuable time with us. You share your knowledge with us. I, on behalf of my committee and the director of the institute, we are thankful to you, sir. The very energetic young Dr. B.L. Shashi Bhushan, who is head of the Department of Pulmonology, Bangalore Medical College and Research Institute, Bangalore, who very precisely explain about the clinical manifestations and elaborate guidelines of the management of COVID-19, stating all the cases of mild, moderate, severe, the line of management, and the pros and cons of the treatment he has shared with us. For your the presentation, I am, on behalf of myself and the committee, we extended a sense of gratitude and thanks to you, Dr. Shashi Bhushanji. My thanks are also due to Manjunath M. Venkateswamy, who has given a very wonderful description about the present status of the vaccine global level, and in particularly the vaccine developmental process of the vaccine in the Indian subcontinent, particularly the pharmaceutical industries which are facing the problems, what are the technical issues, and all the pros and cons of this development of the vaccine. We hope so. According to your description, we are likely to get the vaccines in the next few months, so that we can prevent the infection among the large population of the globe. Thank you for sharing your knowledge, sir, Dr. Manjunath ji. My thanks are due to Dr. Claudia Perkel. That's a very wonderful description. We requested her to come out with this historical perspective of infectious disease with reference to Unani of medicine. Though your area may not be Unani system of medicine, but you are associated with the intercultural, and as a scholar, you represented very well with reference to the Jahangir Nama. Those days, what was the thing happened with reference to the infection, how the infection is transmitted from zoonotics, and all the concept of the management during the period of the Mughal with reference to the Nuruddin Jahangir is also brought to our August audience. Thank you, Dr. Parkal Madam, because it's a very informative lecture. On behalf of my committee for this webinar and the director of the institute, we extend greetings to you. Thank you. Overall, I thanks to all the panelists once again, and my thanks are due to my team who are sitting with me and consistently working for the last few weeks together to come out of this webinar. My thanks to the Ministry of Ayush, Government of India. They have provided all the logistic and other infrastructure facilities. My special sense of thanks and gratitude to my director, Professor Abdul Wadood, who just stand behind me like everything, and he extended all the support to bring this webinar. My thanks to all the participants who are kept alive for the last 48 hours. I can say your participation and active question answer and interaction, all these things makes our program very alive. My thanks to all the participants. Once again, all the people to whom directly and indirectly involved in this program, on behalf of myself and the committee of this webinar, I thanks all of you. Thank you. Thank you all. Jai Hind. Inshallah.